I'm Justin Charles McArthur. I'm the director of the Department of Neurology at Johns Hopkins University School of Medicine. I'm also the director of the Sheikh Khalifa Stroke Institute and was the founding director of a center to study the neurological treatments for HIV infection. So my clinical and research interests really overlap in the area of neuroimmunology, how the immune system and neurological infections interact and intersect. So throughout my career, I've done research into HIV and how HIV affects the nervous system, the brain, spinal cord, peripheral nerves, and more recently have focused on other types of neurological infections, particularly infections related to immunodeficiency. Immunodeficiency caused, for example, by medications that we might use to treat rheumatological conditions or even cancer. My philosophy of care is really heavily influenced by Hopkins' overall mission, which is to provide care to the underserved. And that, of course, was the original mission that Johns Hopkins provided when he bequeathed money to the institution to open Johns Hopkins Hospital. I'm also heavily influenced by some of the patient philosophy of Francis Peabody, who was a physician at Harvard, who said that the secret of care of the patient is in caring for the patient. So I tried to model my own practice and my own approach to patients on those two statements. You'll hear, whenever I do an examination or an evaluation, you'll hear me talk about pets. I have a wonderful golden doodle, Basco, who is the love of my life, and you will hear me talk about him in the context of what pets do you have, what kind of exercise routine do you have, and this is part and parcel of my approach to patients. The second approach is perhaps on a more serious level, which is that many neurologic diseases do not have treatments, at least right now. Tremendous advancements have been made in the last decade, and we are now able to literally transform the lives of patients with certain diseases. But there are many others that we don't have definitive treatments for at this point. So our commitment within the Department of Neurology, especially for those disorders that are not readily treatable, is that we never give up. We will always be an advocate for you and your care. We will always develop some kind of treatment program, whether it's pharmacological, rehabilitation, or neuromodulation, to help you and your family deal with your neurological disorder.